Today's HealthWise, we focus on a killer disease among Filipinos, lung cancer. According to the Philippine Society of Medical Oncology, the disease tops the 5 cancers leading to deaths in the country. Now, what causes this and how does one treat it? Joining us today is Dr. Gia Elena Imelda Ladrera, the head of oncology of the Lung Center of the Philippines. We also have with the studio with us Diego Castro. He's an advocate. His father, veteran news anchor for ANC many years, Angelo Castro Jr. died of lung cancer in 2012, and he'll tell us about his experience with their family. Good morning, Dr. Diego. Good morning. Thank you for joining us.
Good morning, TJ. Thank you for having us.
Diego, I'll start with you. I want to get a sense of what it was like for your family experiencing that with what your father went through. Tell us a bit about what it was like when he was diagnosed first and when he was given this information that he had contracted lung cancer after all these years of smoking.
Well, I'm sure you know my dad very well, and it was quite difficult to deal with two animals at the same time.
Okay.
First was cancer.
Right.
It's like, for me, it was surreal. It's something that I would never have thought would happen. Second was dealing with my dad.
Okay.
Stubborn, macho, and everything was a joke. I remember the day he was diagnosed, and then we said, Dad, it's cancer.
Okay.
And he said, thank God it's not TB, kasi pang mahirap daw.
Okay.
So, from the start, it was a joke.
Okay.
And he took his sweet time to make up his mind as what kind of treatment he would get.
Okay.
He didn't rush into it. He
didn't panic?
No.
Okay.
No. Typical dad.
Okay.
Took him about 2 to 3 months to decide.
And during this time, was he still smoking?
No more.
No more.
Actually, the time he was diagnosed, he was a quitter for 10 years.
10 years already?
Yes.
Okay.
He had a bypass 10 years prior to that, and he quit the day he had the operation.
Okay.
Yeah.
What was the journey prior to that? I mean, as a lifelong smoker, before we got on there, you were telling me he claims he started
He claims.
at 11.
He claims.
Well, let's just put it as a teenager. That's still a lot.
Let's say
It's still a long
teenager.
time.
Okay.
Yeah.
Okay.
Were there ever times that, what symptoms did he show that maybe, we call the smoker's cough, things like that?
Yeah, he had a persistent cough, which would stop, let's say it would stop for 3-4 days, he drink medicine, then the cough would come back, and then he would go to his doctor friends, and he would say, I have pneumonia, give me antibiotics. And of course, given my dad's nature and personality, his friends would say, okay,
this is it.
This is it. And then the cough would go away, it would come back. So he was self-diagnosing.
Okay. I mean, what were the things that you learned from that? Looking back, you knew what the symptoms were as a family. And what you learned from the doctors, could have it been caught earlier? Could he have been quitting earlier?
My mom and I were constantly talking about dad's cough, and he said, I think he has cancer, but I don't know how to tell him. And then she told me, why don't you talk to him and drag him for a test? Finally, during Holy Week, I remember that the cough was getting worse. And then he said, Dad, when we get back, I promise to do some of the things he wanted me to do. I will do that. In exchange, just go for a biopsy.
All right, and when you found out, what's treatment like? I mean, back then, during that time?
He was doing a lot of things. It was a complete lifestyle change.
Okay.
Daily checkups with the hospital. He'd be there months at a time taking treatment. And then, of course, he started a prayerful life. But it was a total lifestyle change. Given that he was diagnosed at stage 3C and given 4 months to live. So, of course, he wanted to... I remember receiving a text. I was in Cebu one time and he texted me and he says, I want to live. Sabi niya, I want to live, but I leave it in God's hands. So I remember that day clearly. And then 3 hours later, he forwarded a text from a doctor and said, my cancer is... I don't know how you call it, but I think it was stabilized. It did not metastasize. So he was actually on his 2nd year already, from his 4 months to live.
That's already a blessing right then and there.
Mm-hmm.
All right, I'll move over to Doctora and let's try to understand, Doctora, what it is, and where we are right now. Like in the Philippines, what's the status of lung cancer? I mean, how prevalent is this and how much of a concern is this?
Well, in the Philippines, it still stands as the the leading cause of cancer-related mortality. Although in incidence it's breast cancer, so we can see that it's a very deadly disease. The fact being that in most cases it will be diagnosed at the late stage in about 70% of cases.
That late?
Because of the non-specific symptoms like the chronic cough, and usually they would attribute this to their chronic smoker's cough. Or sometimes it's just a simple shortness of breath, pain in the chest, or in some cases they may be able to palpate some lump in the neck area, in the armpit, or they would just have this experience of weight loss. Most of the time, in most cases, patients will go immediately to the doctor if they have coughed out blood.
Oh, blood, okay.
But if it's just plain and simple cough, they would tend not to seek out
Let's talk about that myth. No, I mean, is there really such a thing as just a smoker's cough, and it's not a symptom of something worse? Because that's what the smokers tend to believe, that it's just a smoker's cough.
But digging deeper into their history, they will eventually realize, yes, it is a different cough from my previous smoker's cough. Meaning to say that probably they have experienced it to be more severe, more frequent, and the related shortness of breath is more severe than their normal chronic cough and normal shortness of breath secondary to their COPD or just being the smoker.
Okay. Now, how is diagnosis done? What's it like today? Is it difficult? Is it hard to find? Is it expensive? What are the challenges when it comes to diagnosis?
The challenges is, as they have already experienced, patients take time.
It's them who doesn't want to even do it sometimes.
Yes. On the other hand, also, we tend to receive patients who have been going through other healthcare providers thinking that one, it is tuberculosis, two, it is a repeated pneumonia. So sometimes these are very difficult patients that they would tend to believe the TB and the pneumonia because it's a more treatable disease rather than cancer.
No cancer, correct,
and so they tend to delay the ultimate biopsy.
So the biopsy is the ultimate test?
Yes, it's the gold standard, as we call it.
And when they get the biopsy results, normally what's next? I mean, what do you do with the interpretation? What should the patients be doing right away after that?
Well, nowadays, especially for patients who have advanced stage lung cancer, we do testing of the tumor in a stepwise manner. So in this age and time, we tend to characterize the tumor first based on how it looks like under the microscope. Okay, because tumors, lung cancer, tend to respond to treatment differently.
Okay.
So we need to characterize them in terms of their histology and fingerprints, biomarkers. So there are several other tests that we need to perform, like the EGFR and the PDL1, because it directs the caregiver or the healthcare provider on what is the best option for this particular patient.
All right. Now, we've when you talk about cancer, of course, the top of mind people think of in treatment is chemotherapy. Now, but there's also this immunotherapy. So tell us a bit about this and what immunotherapy is and what benefits might this have over chemotherapy.
Well, just to give a background, so the immune system is the one that guards us against invading microorganisms. So they are the policemen of the system. So they would tend to find out which one belongs to the body and which one are the foreigners. And this, because of the differences in the protein of the microorganism, the bacteria, the virus, as against the normal body protein. But unfortunately, studies have found out in patients with cancer, the immune system is rather low, and they will not be able to recognize which one is family and not. And they would just allow the lung cancer or the tumor to go ahead and multiply.
Understand. Okay.
So they would not be able to recognize it. Not recognizing it, meaning they will not attack it because they would tend to believe that these are part of the body.
I see.
So the immunotherapy is one that tends to make it to re-educate it. Okay, so we need to find out if the lung cancer tumor has this kind of protein, which is a PDL1, because this PDL1 found on the tumor tends to hijack the immune system, so to speak, and making it believe that I'm part of the family. But with this immunotherapy, they tend to block this PD-L1, and so now the immune system will not be able to recognize it as family and therefore attacks it.
There you go. Okay. Now, plain and simple, is this like other cancers that if it's caught earlier, stage 1, stage 2, is it much more treatable, or the chances of surviving much higher?
Correct. The earlier the cancer, in whatever form of malignancy, the better chance. And in most cases, the best way to treat early stage cancer is to move it, to remove it by surgery if it's possible.
Now, to wrap this up, going back to Diego. Diego, your advocacy now, your family, as the doctor said, if it's caught earlier, it's much more treatable,
Yes.
chances of surviving higher. Knowing that information now, and your experiences, what is your message out there to other families who struggle with this? And as you said, it's not simply just that part of it. No? It's dealing with that human being,
Yes.
of his attitude, his or her attitude towards life, and that habit they've had for a lifetime. So what is your core message to the
Well,
people out there?
my message, of course, is to man up. Stand up if you're scared of your parents, loved ones, or your wife, or you get them to get tested right away.
Okay.
That's what I've learned, that if had I told my dad a year earlier, we might have caught it, Doc, at stage 2. Maybe he would have lived longer. And it's important to give also the message to family members that how important our roles are as a support system, because we have to understand, person with cancer has been told that he has a certain number of days, months, years to live. So he's thinking, his mindset is different.
Right. Yeah.
So I hope that my advocacy with other doctors and other people, I hope we can get the message across that there is hope.
Right.
And of course, they could get in touch with me as I also give advice on social media.
Great, yeah.
For people who need help.
All right. Well, thank you for doing that, and we need more people like you to speak out and to give that support. So, Diego, thank you for that,
Thank you.
Doctor. Thank you for the information today, and for those smokers out there, if you have these doubts, if you have a family member, do get them tested, as Diego and Doctor said, because that's where it begins. And when you get that information, then you can get on to that path of healing, right? So, thank you so much for joining us again. Good morning. Thank you.